I know there's a lot of stories about AI replacing people, but we believe that the opportunity is leveraging AI to complement what your current team is doing.
Right now, we'd suggest people to try the wide range of products that we see growing and growing every day. I think the other day I saw macaroni and cheese was at one of the
Yeah.
retailers.
How is it that we keep this thing illegal from adults to consume, and yet there's children and the elderly who, without this, wouldn't be able to function?
It's Reefer Madness, the podcast, with Trevor and Kirk.
Kirk,
We're back.
how's it going, Trevor?
Good.
What did you think about the virtual pharmacy?
And I will probably say this a couple more times after we come out and people know what I'm talking about. I think I want to work for them.
Yeah.
Yeah. And I'll try to keep this brief because we want to hear their story, but they are solving problems I'm seeing today. Like literally within the last month, 2 or 3 times I've had and I'm not pooping on the doctors, just this is what I've seen. I've seen doctors refer patients, like literally write down on a prescription, write down on a piece of paper, go to the rec store and ask for X, which is, it's not ideal. We've discussed before how that's not ideal, but rather than just saying why don't doctors do something different, I know I personally have then sat down with the patient, physically called one of the local stores, looked up on their website, see what they have. Usually I'm looking for like a high CBD, low THC, like 20-to-1 mix. And if they've got it, I'll say, Mrs. X is coming down to get this. Do you have it in stock? You put it aside for her. And the budtenders have been really good. So, and then, I write up a little plan for Mrs. Smith about, okay, here's how you want to dose it. Here's how we're going to slowly increase it. Because for better or worse, I won't say our local docs aren't interested, but it's not something they know a whole lot about. And like I even had, again, I'm not picking on them, but I had one younger doc she was interested, which is good. But I don't think she understood that she could write a prescription and have it sent directly to the patient. And there's a whole bunch of things about that system which is inconvenient as all snot. Like the patient then has to be able to go, even when you do it properly through the medical system, the patient has to be able to go onto basically all the doc does is give you permission to go onto a LP's website and order it like you order something off of Amazon, which for most people is fine, but as our fantastic entrepreneurs are about to talk about, the people who are interested in medical cannabis skew older, and some of them honestly are not that computer literate, and ordering something online is not something they're either comfortable with or even capable of. So anyway, I don't want to steal too much of the thunder, but they've got set up here is fantastic.
I'm sitting here with a huge smile on my face because, Trevor, we haven't even introduced the episode yet. This must have really triggered something in you. Should we at least introduce the episode?
Yeah. Yes. Kirk.
So once
Kirk,
upon
you
a time,
you talked to a couple entrepreneurs, Kirk. Tell us a little bit more about them.
Yes, I did. Once upon a time, there was a pharmacist in Ontario that went and talked to a rec store operator and said, "Hey, I'd like to provide you a service that you pretty much just talked about. Why don't we just jump into the episode?" And you're right. They're entrepreneurs. They've found a niche. They
found a big problem and solved it. They are doing good things.
Let's go into it, and we'll come out, and then maybe I'll let you rant some more.
All right.
My name is Lisa Bigioni, and I'm the owner of Stok'd Cannabis. We have 4 retail stores in Ontario, 3 in East Toronto, and 1 in Niagara Falls.
You have a pretty unique business. Like I was looking on your webpage, your whole business is to make it camp-like. You walk into your store and it's backcountry, woodsy. Is that sort of the motif?
Yeah, that's our brand. Our brand, when we were figuring out what we wanted to be, we determined we wanted to be welcoming, inviting, non-intimidating, and to us that kind of meant Canadian and what it means to be kind of hanging around a campsite or a cottage up north in Northern Ontario or any province, in fact. So we built our brand around a kind of chill, relaxed vibe.
Well, that's cool. And I have spent time paddling in Northern Ontario, so I get the vibe.
There you
I
go.
get the vibe. And Anushya, please introduce yourself.
Yeah, my name is Anusha. I am a pharmacist based here in Toronto, Ontario. Graduated from the University of Toronto back in 2018. My business partner and I, Ajay Chahal, and myself graduated in the same class. And graduating in 2018 was, the same year that cannabis was becoming legalized. And we said, hey, pharmacists don't really know anything about cannabis. There's nothing in the curriculum. We're going to have patients coming into our pharmacies asking questions. How do we handle this? So we kind of understood it from a physician's perspective in terms of how they were prescribing medical cannabis, and then looked at it from a pharmacist's perspective. What do we need to know, especially when it comes to drug interactions? If someone is coming into a store saying, hey, I'm on cannabis, but I'm, also on these prescription medications. Are there any interactions? What do I need to be concerned of? Are there any side effects? So on and so forth. Is it safe for me? And so we kind of dove into the literature, understood everything that we need to know as pharmacists, and started our company, Apothecare. So Apothecare was founded back in 2018 and has been growing. Initially, it was an educational service to pharmacists, specifically in the whole health pharmacy banner, where we were educating pharmacists on how to be doing these types of consultations for patients. And what we found in a busy pharmacy setting is that, there's no time. When you're having someone that's never been on cannabis before, especially if they're elderly, you do need at least 30 to 45 minutes to have a really thorough conversation to educate them. And that in a busy pharmacy setting, there's just no time. And so we said, you know what, let's just go direct to consumers in terms of our services and offer these consultations ourselves. So our target market is essentially Canadians that are walking into retail cannabis stores, so legal cannabis stores. They're asking, about using cannabis for health and wellness. And those are the consumers that we are speaking to, those walking into the retail stores. So there is the medical cannabis route. A lot of patients are finding it very difficult to be going down that route, especially the elderly population. It's very convoluted for them. They get very confused. They want something simple and easy, and that's why our services are there. We find that it's better for them to be speaking to a healthcare professional rather than just going into a store, asking a bud tender not being able to give medical advice, and them being left in limbo, or them, purchasing a product, not knowing if there is a drug interaction and something harmful happening. And that's kind of where our services fit in. And we've just recently partnered with Stok'd.
Fantastic summary. A couple things. Are you a brick and mortar store now, or are you and your partner working in the cloud, or are you a brick and mortar store?
So we're completely virtual. So our services are offered across Canada. So everything is virtual. So either through video consultation or phone consultation. And depending on where they are in Canada, if we have partners, for example, if we have someone from the Scarborough area and they've been referred from Stok'd, we would take on those patients and do that consultation virtually. We would bring them back to store level to get them to fulfill the product sale at that specific store. We work with retailers where we're looking at their menu, understanding what they actually carry in store so that we're able to make a recommendation for a product that they can literally purchase right after the consultation. So we try to make it quite seamless for them.
Okay, so you're not two people in lab coats sitting behind a counter with a whole bunch of meds in the back.
Well, Ajay and myself, we do own two whole health pharmacies in downtown Toronto. So we do operate two pharmacies. So we do that along with building Apothecare. But yeah, we're not in the pharmacy doing these consultations. Yeah.
Okay, so Apothecary is a virtual service.
Virtual service. Yeah.
Okay, and I guess, Lisa, so this is a mutual exclusive relationship you have with each other, or can you go and get other consults from across Canada, or How does it work? How's the relationship work?
Well, as far as I know, Apothecare is the only organization that's offering these kinds of consultations for cannabis customers. And the challenge that we have, and I think that all retailers have across Canada, is that the regulations prohibit us from giving medical advice, which completely makes sense because we are certainly not medical practitioners in our stores. Our bud tenders don't know anything about the medical side of cannabis. And we've been in there's been a gap because while we aren't able to answer the questions, there's certainly customers coming in on the daily asking us about cannabis use for sleep, for pain management, for anxiety, for appetite related to drugs that they may be on for other medical conditions. And so there's been this gap, and we struggle, and our bud tenders struggle with how to address those kinds of questions. We always have to say, well, we actually can't. Please go back to your doctor. Please approach a medical clinic, medical cannabis clinic. But this partnership with Apothecare, which we're really, really excited about, gives us a definitive avenue, a phone number for our customers to call and get the answers that they need. And it alleviates any compliance concerns that we have related to the Health Canada regulations.
This is fascinating to me. Trevor and I often talk about this. There's so many avenues and so many paths I want to take this conversation. So let's start first with the legalization of cannabis and the responsibility of pharmacists. Now, in Manitoba, the College of Pharmacists have pretty much told their members to stay away from cannabis as medicine. They pretty much have said that it's not the job of the pharmacist to look at cannabis as medicine. Is it different in Ontario?
So in Ontario, when cannabis became legalized, the Ontario College of Pharmacists mandated all pharmacists to have like a baseline training in terms of cannabis because they knew that we were going to be getting questions, and so they wanted us to be able to kind of give that baseline knowledge. But to be honest, that course is mostly legislative. Like they wanted us to understand what are the laws behind the Cannabis Act, and a little bit on drug interactions, a little bit on like, what products are available. But other than that, there really wasn't anything else. We basically, the college has said that, we need to do what it is that's in best interest of the patient. And so for us to give any types of counseling points, identifying drug interactions, that is our responsibility to ensure patient safety. So that would be the perspective here in Ontario.
So is the nuance that cannabis is a medicine then, or is the nuance that cannabis will be a substance of misuse, therefore you should be knowing about it? What's the nuance?
I think it's kind of both, to be
Okay.
honest, right? Because in the pharmaceutical setting, like we do have epilepsy patients that are on like a prescription version of a cannabis product. So that is being dispensed. We have nabalone being dispensed, synthetic THC, being dispensed. So I think they 100% do want us to understand that medical perspective, but they also do want us to understand that abuse perspective as well, although it's not as, prominent in the training that was provided. It was more so, how, like, what is the Cannabis Act? What can and can't you do? And understanding it from a medical cannabis user's perspective as well. So yeah.
That's interesting to me. In the sense of the process, one of the things I like to do in the summertime is my wife and I have an old van it's a van with a bed in it. We go camping in it. We travel a lot and we go from small town to small town. And I visit rec shops across Western Canada. And I feel, Lisa, that bud tenders are very limited in what they can say. But you made a comment earlier about how they don't know a lot. In my experience, bud tenders tend to have more education about cannabis than many of my colleagues in the healthcare field.
Yeah, I would absolutely agree that bud tenders know a lot about cannabis itself, For sure. I mean, that's their job and it's also their passion for sure. And that's what we love. That's what Stok'd loves about the teams that work in our stores. But that knowledge doesn't translate to medical use. While they know a lot about cannabis itself, they don't know a lot about drug interactions. In fact, I would, venture to say they know nothing about drug interactions. And so that's where there's this challenge for the bud tender. Certainly, we can say this gummy would help you sleep. And frankly, for the menopausal woman who may not, have any other medical issues, she just can't get to sleep and stay asleep. She can likely get those answers in store without a medical consultation. She can try a gummy and it likely will not, have any adverse effects. But for other customers who have other medical issues, serious medical issues, or bigger medical issues, that's where we have no idea how taking any sort of any sort of cannabis from a gummy to, a resin or rosin, we have no idea how that will affect the drugs that they're already on or just their general well-being. And that's where we need an organization like Apothecare.
Again, I completely agree with you. Like I said, when I first read the message that was pushed to me, I went, "Oh, this is interesting." Now, what we haven't really clarified here is that this is a rec shop, right? You are a rec shop. You're recreational cannabis. You are not a medicinal cannabis dispensary.
Correct.
So you've brought in healthcare people to help you, and I guess this is beyond anecdotal. This is actual factual. So what you're telling me is that you have people coming into your store looking for medical cannabis, right? They're cannabis for medical purposes.
Yeah.
Right.
Yeah.
So who reached out to who here? Who made the first thought that this relationship should start?
Yeah, so I mean, Apothecare has been visiting retailers all over Ontario, and we are partnering with retailers that have that, like mindset in terms of, being able to help Canadians that are, trying to use cannabis for a health and wellness purpose. They do have a great variety of products when it comes to wellness products, a good selection of oils, topicals, capsules. And so Stok'd definitely is that. And so when we walked into the store, which are beautiful, by the way, beautiful stores, we just found that it was a great fit. And also to kind of add to Lisa's comment on bud tenders, we really do value the knowledge that bud tenders have. So at Apothecare, we kind of do a very balanced approach for us. We do look at the scientific literature, understand, what is the evidence behind cannabis for various different types of conditions, but we also value the bud tenders insights because a lot, when it comes to the minor cannabinoids, the research really isn't there, and we're really looking to see anecdotally what are customers using and what are they finding benefits for these, minor cannabinoids, especially like CBG and CBN, CBC. So we kind of look at it from both perspectives. Whenever we do have a consultation, it's always a very balanced approach, and we're very transparent in terms of products that are out there, the potential benefits that it might have, what is very, evidence-based, where is, the literature really not there yet. And so that is very transparent. And yeah, just to kind of circle back, we have reached out to retailers that are always health and wellness kind of focused. There is a portion of their customers where they are seeing them come in for those health and wellness questions, and Stok'd was definitely one of those retailers.
I was just trying to look up Saskatchewan. I was going through a small town, Saskatchewan, and walked into a tweed shop. I think it's Tokyo Smoke now, but I walked in and the manager, it's cold call, right? I got my dog with me. I walk in and going, I have a podcast. I'm looking for quotes. I want to know what's happening in your little store. And one of my most favorite quotes that we've had in 7 years is a young lady who said, CBG, it's a bubble wrap for my brain.
Mm-hmm.
And I looked at it and Okay, CBG, the mother cannabinoid is bubble wrap. And it was funny because from that point forward, it seemed like every rec store I went to, CBG was the big one. This year, the big ones are now all infused reefers. Everything's infused and everything's like THC up the yin yang, and it's like, oh my goodness, right? So, what do you find? And this is just a question off the top of my head. What do you find is the most what are people most interested in? Are they most interested in flower? Are they most interested in topicals? From a medical perspective, again, this is very odd for me to have this conversation because we're talking to a rec store provider about medicinal cannabis, and the federal government has kind of said in soft tones that they're now questioning if we need to have a medical program. So that's another question I'd like to go down. But let's talk a little bit about your store and when people come in to a rec shop, what are they going to? Are they going to the flower? Are they going to vape pens? What are they going to?
Well, I think it depends what issue they're trying to solve, right? I can give an example of a long time customer we've had who has stage 4 cancer and is on a whole bunch of medications. She comes in and buys a lot of flour. She buys flour by the ounce, and for whatever reason she's using it, whether it's pain management or appetite or what have you, she buys a lot of flour. We get a lot of people coming in looking for pain solutions who are looking at topicals, certainly, right? Muscle issues, back, that sort of thing. Gummies are big. I made the reference earlier, and it's certainly not only menopausal women like myself who are looking for sleep help. But a lot of people have challenges sleeping and getting to sleep and staying asleep. And there's a lot of chatter out in the world, whether people are cannabis consumers or not, about the fact that gummies can help with sleep. Right. We even see kind of false advertisements in magazines, Oprah endorsing a gummy, that sort of thing. So we are seeing a lot of people coming in looking for gummies. Drinks, again, like, having a drink before bed to kind of relax your body and mind to get some sleep. Those are the kinds of things they're telling us about that they're looking for medical assistance with. But I think it all depends on what the issue is that they're trying to solve.
So they come into your store and they say, I'm in stage 4 cancer. Holy crow! I want to use cannabis. And you say, okay, well, here is a cannabis strain that might work for you for whatever reason. Do you then hand them a business card or a brochure that pushes them to Apothecare? Is that
so? First of all, we would not say here's a strain that would work for you. We would say, my goodness, that's horrible, but I'm not a medical professional. And so I can't justifiably recommend a product for you to take. I can imagine that you're also on other medications for your illness. And so it is our recommendation that you would phone Apothecare. Here's a pamphlet, here's a phone number. You have a consultation with a licensed pharmacist who understands drug interactions and understands cannabis use medically. Have that conversation. It'll be 30 to 45 minutes. And then hopefully you'll get a recommendation out of that you can come back to our store and ask us for some product.
Perfect. So the patient now comes to you, and what does Apothecare do? What's their process?
Yeah, so essentially any referral that we get from a retailer, we will have an initial consultation with them first, just to ensure that we are the right medical professionals to be doing a consultation. If this patient is an epilepsy patient, MS patient, in this case, we're going to absolutely refer to the medical cannabis route. Those are, very complex patients where definitely a physician needs to be there in assessing them. So we do that initial screening first. If we're chatting with them, we feel that this is definitely an appropriate method for them to come and see us. We're going to do an intake with them. So we do a proper, full, thorough intake, understand everything when it comes to their medical history, prescription medications, what they've tried, have they used cannabis, are they cannabis naive, understanding, the full perspective of that patient, even when it comes to addiction as well, family history of addiction, that's very important for us to be assessing as well. And then from there, we will get them booked in for an appointment. And typically, this is about 30 minutes. It's either a phone consultation or video consultation. We do everything virtually through an application known as the Jane app. So, this is a practice management software that we use. So, everything is HIPAA and PIPEDA compliant. So, patient privacy is absolutely, taken highly, very importantly. So, that is all done. We will do the consultation with them from start to finish. Typically, it's about 30 minutes where we dive into their intake form, understand what they're actually looking for. If they tried cannabis in the past, where have they sourced cannabis? So it's another part of harm reduction. Where have they been going to source their cannabis? A lot of these patients that we do see, they go to illegal stores and they don't know they're going into illegal stores. So that's a point of education as well. So talking to them about that. And then also, the types and formats of cannabis that's available on the market. What are they comfortable with? For us, it's always, again, a harm reduction approach. So we're avoiding smoking and vaping, and we're going to alternative forms of cannabis, typically oils, capsules, and topicals, and even edibles as well, gummies and drinks. So those are all laid out for them so they understand methods of consumption. Once we figure out a suitable product, suitable cannabinoid profile for them, we will basically contact them with an entire breakdown of, this is the product that you're going to be going for. I've already communicated, for example, with Stok'd, let them know that you're coming in for this product. This is how you're going to be taking it. This is your dosing titration schedule. We're going to be following up in X number of weeks. And then, for me, I really like to look at it holistically as well. We're looking at, their vitamin and supplement intakes as well. What could they be doing to optimize, whether, maybe it's pain, maybe it's neuropathic pain. Are they, taking certain supplements that might be helping with that, even for headaches and migraines, assessing, vitamin B intake for them. So this is kind of like a full thorough workup and assessment for them, and so they have a plan. And every patient that we do these assessments for, they're very grateful because they have no one to be having these types of conversations with. Either they don't have a family doctor, or their family doctor doesn't want to talk about cannabis. And then they don't know what to do. And so they're very grateful. I've even had patients that have been using cannabis and they just haven't found the right product for them, and just kind of tweaking things and optimizing things for them so that they're able to, get them maximum benefit. So it really, that's kind of the process. I've even had patients that come from the medical side, and they're elderly and they can't figure out the medical route, and they say, okay, this is what the doctor prescribed me, but I can't figure out the medical side. Can we just do a consultation? So even doing those consultations, sometimes I catch things where it's like, a CBD oil for you really isn't appropriate. Your kidney function is declining. You're on a blood thinner that would interact with CBD. You would be at an increased risk of bleeding. You're 85 years old. This is not appropriate. Let's go for a topical formulation. So, sometimes we even catch those things coming from the medical side. So it's a really thorough assessment from our end.
It sounds to me that you're giving them a care plan, obviously.
Yeah.
So I need to take a step back then. In Ontario, the scope of practice of pharmacists, do you have a limited prescribing ability?
So in this case, this is a recreational product. So that's the nuance here, right? So, anyone can be walking into a recreational store. I like to call it a retail store because there's a mix of different customers coming in there for both recreational and health and wellness purpose focused in terms of their use of cannabis. So I like to call it a retail store. But yeah, so for us, it's almost as if you're doing an OTC counseling, right? If someone's coming into a pharmacy, they're asking about, Advil or Tylenol. How are you going to work up this patient? What are the red flags? What are the, contraindications? What prescription medications are they on? It's kind of almost like an OTC assessment, because it's either them going into a retail store, getting product, and potentially having a harmful outcome, or me actually doing this assessment thoroughly to ensure that whatever product that they do get is going to be safe for them.
Yeah, that's the that's the thing about cannabis. Eh? You just walk that line. Is it medicinal or is it recreational? Is it medicinal? So I get it. Over the counter consultation, that makes a lot of sense to me. Uh, on your webpage, you talk about the fees. Are the fees mostly covered by insurance programs, Ontario, or would it be my private insurance? How would the fees be covered?
Yeah, so for us, unfortunately, we don't have an OHIP billing number. Pharmacists here in Ontario don't have that, so it's not something that we can bill the government, unfortunately. So this is an expense that would be paid out of pocket for the customer. But if they do have a health spending account, we are a healthcare professional that is listed as one where we can issue a receipt, and they're able to claim this on their health spending account. And so that is one method for reimbursement.
Okay, and at the beginning you talked about your nationwide. So this is an Apples Up thing, a Canada program, which is fantastic. So do you have free trade with your profession? Can you consult in British Columbia, Newfoundland, as a
Yeah,
pharmacist?
as long as we're here residing in Ontario, we can have these types of consultations virtually. Yeah.
Okay. Well, like I said, I find this a fascinating model. I had alluded earlier how the federal government seems to be quietly questioning if we need a medical cannabis program. Um, what do you think about that? I mean, you guys seem to have balanced something really nice here. You've taken responsibilities at the rec store for people's health care and wellness, and I wrote this down: health and wellness. So a cannabis store worried about people's health and wellness. What is that all about?
Well, the Ontario Cannabis Store has released data as of last year that 1 in 5 consumers walking into a retail store are purchasing cannabis for health and wellness purposes, which is crazy. So 20% of customers
Yeah.
are doing that. So that is documented, that those statistics are out there. When you look at in the States, New Frontier data has come out with, about 33% of those consumers going into rec stores are wellness focused customers or wellness seekers. So, I feel like even these percentages are probably underestimated,
I
to be
agree.
honest, because a lot of these rec users are using it for wellness purposes as well. And so there is a overlap between them both. So these values are probably a lot higher than what's being documented.
My experience in the American model, though, is that you walk into a store and one side is recreational cannabis, one side is medicinal cannabis. And they actually have, again, this is limited experiences in Colorado when I was there a few years ago, is that if you walk into the medicinal side and you have a script or a document from a physician, you get a price cut and all that sort of stuff. That's not in Canada, right? I mean, the disconnect in Canada is that the medical cannabis program is federal, but the provinces manage medicine. So that's where the disconnect is. I like what you're doing. I just find it interesting. You have found a real niche that is definitely needed, because I completely agree with you. I'm astounded by how many people go to rec stores for the medicine, and I'm astounded by how the medical professions, and that's all of us, have completely ignored it, and it's wrong.
Yeah, like even our consultations, the average age of our patients that we see, average age is 61. They're on three, like about 45% of them are on 3 or 4 medications. So it's crazy to think that, a lot of these types of customers are still going into stores purchasing product. There might be significant interactions, and especially when it comes to cancer patients as well, like, especially those that are on immunotherapy, is someone intervening where, someone is counseling them on potential, failure rates of immunotherapy when they're on cannabis. So, yeah, I think there's just there are a lot of issues, and we're trying to solve a part of the piece.
I
Yeah.
think what's important to note too is that customers coming into a rec store won't necessarily disclose the reason they're buying the product that they're buying. In a lot of cases, we hear from customers who say, my son told me to buy this, my friend, my daughter, whatever, told me to buy this. And when you start to probe as to, why are you buying that oil in the first place? There may be medical reasons that come out of that. But if they just walk up to the counter and ask for their product, and the conversation isn't had, there could be some safety concerns. So the fact that we now will have Apothecare collateral, pamphlets, whatever, in our store may, at a minimum, tweak those customers to think maybe I should have a conversation with a medical professional about the thing my son or daughter or friend told me to buy before I start to consume it.
Yeah, I like what you're doing here. It's how many times I've gone out and had casual conversations. For whatever reason, cannabis always seems to come up. I don't know if it's me. I don't know. It could be me. I could be the common denominator. But I always end up talking about cannabis with somebody. And how many people are using gummies, like the funny little gummies before bed? It seems to be a T-shirt I want to get. I take my gummy before bed. Is there anything else you'd like to talk about?
I guess I just want to add that, the wellness category is growing here in Ontario. We are getting more and more wellness products coming out onto the market. And so, when you think about it, it's like, how are we supporting Canadians if there are more wellness products coming out into the market? And so I guess just wanted to kind of bring that point up. A lot of the zero THC products coming out onto the market. And so there definitely is like a growing interest when it comes to wellness and cannabis, and hopefully we're able to support more Canadians.
Yeah, and from a rec store perspective or a cannabis retail perspective, the wellness category is certainly the smallest category of sales in our stores, because we are a rec store and people are coming in typically to buy flower, pre-rolls, and infused pre-rolls, as you alluded to earlier. But I really see that growing as the stigma continues to diminish and as awareness and understanding about cannabis and its benefits starts to grow. I think we'll see more and more people asking the questions about more of a natural way to address their, at least even their smaller, quote unquote, smaller health concerns. So I think this is the way of the future. And the other thing I'd like to mention is a lot of customers of independents in particular, I'll say, have a strong relationship with their cannabis retailer. They come in, once a week or even more often than that. They know their budtenders by name and vice versa. And so as that continues to expand, I'm just thrilled that we can now offer an additional service, again, to bridge that gap between recreational use and medical use, that helps everybody.
All right, go ahead and rant. I want to.
So, Kirk,
hold on.
You want to know how I really feel.
Before you start, I want to ask a quick couple questions, because this is obviously this. As soon as I talked to these guys, I knew that this is what was going to happen. So a couple of things, okay? Jurisdictional. Is this something that Manitoba? Now, don't start yet, because I know you're going to rant.
Sure.
So jurisdictional. Can Manitoba provide this service in your thought? Now, the other thing is that what I liked about this was that they are definitely providing a service, but it's private healthcare, because people have to pay for it using their private insurance, right? And that's a different issue, but recognizing the fact this is not universal health care, which is one of the problems that cannabis isn't a medicine in provincial health care. Now, go ahead, rant.
Well, let's talk about money first, because, one of the things that you and I see differently, I'm not saying people shouldn't get things paid for, but in pharmacy world, unlike in nursing world, there's a lot of things people have to pay for. And that was actually one of the things I was most interested in hearing is, all the provinces, as we've mentioned before, do things differently in different professions. And Manitoba is arguably the worst province in the country for being a pharmacist. There's several good pharmacy things that are good, but as a pharmacist, I can't really bill for anything. Like, I can't do something for a patient and then have the government pay me for doing said thing. Like, these pharmacists are based out of Ontario. They can do what's called a meds check, which is literally go through someone's medication list, find problems with it, recommend solutions, and I'm going to get it wrong because I'm not from there, but let's say you can do that 4 times a year, and the pharmacist can get paid for their time to sit down and go through that. Manitoba, there's no such thing because, Manitoba sucks.
But hold on.
Sure.
So the government, you're saying that they said they could not bill to the Ontario government.
This is why I was into this. So that's why I'm throwing meds check out. So in a pharmacy, let's ignore the cannabis stuff for a second, but in a pharmacy in Ontario and in some other provinces, pharmacists can get paid for doing basically a medication review for a patient. Manitoba, you can't because Manitoba sucks. Anyway, so that was my first thing is, are these pharmacists getting paid for doing a quote-unquote medication review as part of a meds check? And no, it doesn't sound like they're doing that. Could they, couldn't they? I don't know. I'm assuming they looked at it and it wouldn't qualify for some reason. Again, not an Ontario pharmacist, so I don't know all the ins and outs. So I was very interested in as the greedy pharmacist, how they were going to get paid, because, they are putting out a goodly chunk of time, a half an hour to an hour-ish consult with the patient. You can only do that for free so many times, and you are running a charity, not a business. So I thought that was fascinating. I'm not saying best case scenario. It'd be wonderful if the government would let them bill for it or let us bill for it, but it makes sense to me as a pharmacist that they were charging the patient, and in a perfect world the patient has some sort of insurance plan where they were allowed to then claim that back from their insurance. But I thought that was really interesting. I wondered how they do that, because if I was going to do something like that in Manitoba, I would absolutely have to charge the patient directly, because there's no other way for me to get paid for my time. So I was really interested by that. But let's go back to could I do this in Manitoba? I don't know. I could absolutely do it within the province of Manitoba, but honestly, when we talk about telemedicine or telenursing or teledoctoring, the only time I've looked into it is when it's like a nurse practitioner, a physician, can they see someone in another province and still bill their own healthcare system? And the answer is sometimes yes, sometimes no. Since a pharmacist can't really bill, it's never come up, and nor has let's put on a different hat. I've got some extra training in asthma, COPD, and smoking cessation. Do I have the skills to teach somebody in Newfoundland how to use their inhaler and create an asthma action plan and report some stuff back to their doctor? Sure, I have the skills to do that. If my butt is sitting in Manitoba and I'm virtually talking to them in Newfoundland, am I breaking some kind of rules? I don't have the foggiest. Did I kind of sort of answer that question?
I think so. Because I guess how I look at it, because nursing's in the same boat, right? Nurses, even nurse practitioners, prescribers in Manitoba cannot bill directly to the province. We are seen as employees. But I am also, I'm the secretary of the Canadian Association of Self-Employed Regulated Nurses. So there are private practice businesses that nurses have. I have a business as a nurse. I don't work for another employer, I work for myself. So I bill as a nurse for my skills. Now, there is a process of doing that following the college, but I can't bill the college. I can't bill the province directly. But as a nurse, I can contract my services, right? So my question is, they are pharmacists in a virtual pharmacy. So the pharmacy is the business, they are employees. So the pharmacy is submitting an invoice to the insurance agency, and as a patient, I then click on a box, I get $65 or whatever it is.
I'm not trying to put words in their mouth. I think the virtual pharmacy is billing the patient. Here, Kirk is a bill for $120, and then if you, Kirk, the patient, wants to take that $120, I'm making up numbers, but again, that invoice and submit it to your insurance company, you can. That I don't think they are directly submitting anything to an insurance company. But before we get too lost in the weeds on billing, because, you know, fascinating for me as the pharmacist, maybe not so much to the non-pharmacists out there, I thought you hit on a really good point that I want you to talk about a little bit more, because it kind of turns a little on our head stuff we have been talking about. So people are now going to rec stores to get medical cannabis. They just are. You know, we have lamented about, we wish there was a better way and how could we get, but they are. They just are. And you've also noted that maybe the federal government wants it to go that way, doesn't want there to be a medical system. We don't have direct proof of that, but, you know, their actions seem to be saying that that's not, at least not something they're not interested in. What do you think about this as another way? Like, you know, patients are showing up at rec stores to get medical advice anyway. This is a way for them to, might not be perfect, but this is at least a way for them to have a chance to get some medical advice.
Well, you nailed it in your opening rant about here are some entrepreneurs that found a niche. So I'm going to answer the question this way, in the sense that there is a need for this. I lament to the fact that the healthcare system says that cannabis is a substance of misuse. Oh, but if you decide to use it as medicine, just go get it from your rec store like you would buy Tylenol as an over-counter med. After 7 years of studying cannabis the way you and I have been, I find that resentful. I physically get a sense of regret and also embarrassment and disgust that my health profession has chosen to view cannabis this way. Because the hypocrisy of using pharmaceuticals off-label is horrific, and is probably the number one reason why I keep saying, if you're prepared to use a drug off-label, why are you not prepared to even consider cannabis as medicine? So to answer your question, is I think it's ludicrous that people go to a rec shop. However, it's happening. It's the way of the world. So let's pivot. And what we discovered here, and this story was pushed to me, right? And I sort of pitched it to you. You couldn't find an opening that worked, so I did the interview, but I knew it was yours.
And I think you did a great job. I think I would have asked way too many stupid, not, you know, pharmacy minutia questions. I think this was good that I got to hear it afterwards.
Well, but they. I mean, we've done a few stories in the last little while. Cannabis coaches, and I'm coining the phrase. They're a non-regulated health provider, right? They're sort of like athletic therapists. They're, you know, non-regulated sports therapists. I mean, we have a niche. People need to be educated. Our colleges. I shouldn't say the colleges, you know, I can't blame my profession for this. I have to blame the individuals for this. Individual health professionals are not paying attention to cannabis, and that's wrong. So therefore, entrepreneurs are going to pick it up. So here is a couple of health professionals, pharmacists. They created a virtual pharmacy, and they are going around to rec stores like Stok'd.
I was going to say, let's circle back to Stok'd, because Lisa and her team, they've developed a very cool store. My notes say four Ontario stores, 3 Toronto, 1 Niagara Falls, if I'm getting that right. I like the outdoor feel. That all sounds good, which is all great as a rec store. You know, I'm selling to people who want to get high, which is fine. Just like, frankly, a liquor store sells to people who want to get drunk. So that's perfectly fine.
But we pledge we want responsible drinking. Sorry.
Responsible drinking and responsible smoking and all that good stuff.
Yeah.
But full credit to Lisa and her team to say, but at least 20%. I think it was actually Anushya who said that, the Ontario Cannabis Store stats was about 1 in 5, or about 20% of people basically admit to going into their rec store looking for medicinal stuff, and everyone assumes it's higher, but that's at least a number that has been measured. So Elisa and her team have obviously noticed that and said, hey, we know a lot about cannabis, we don't know a lot about people's medical conditions, and we don't know a lot about the medicines they're on. How can we do it better? And, kudos to them for recognizing that, and then recognizing that Apothecare would be a great partner.
Yeah, and like it's going back, it's exactly. They recognize a niche. There is a niche. The niche is created because health professionals are generally ignoring it, and also, I guess, we know you say doctors that are pushing people to the rec store. I've also heard doctors say that just go get your pot from the rec store, and I've written about this in our blog page how I think that's negligent. But yeah, it's a niche, and it's one of the reasons why I like doing this podcast is we find interesting people. There's a whole lot of stuff that I don't know if we have the time to discuss that's in there, but I love the fact that it's nationwide, it's elbows up, it's Canadian business, and they're doing something that that you recognize people need, right? So
yeah,
I mean,
absolutely.
And I want to congratulate you because I know this for sure. I mean, I walk in the rec stores all the time, just asking questions of what's going on in the rec market. And there is one particular store in town that knows you very well, and they do call you the pharmacist, the pot pharmacist in Dauphin. So I love the fact that you take the time, and again, I know you're not getting paid for it, but you take the time to call ahead and say, and I don't think you're breaching any confidentiality here.
No.
So no, it's so you.
Yeah.
I love the fact you're doing that. So I guess congratulations to you for taking the extra time.
Yeah, no, but again, I'm not tooting my own horn, but I can only take my time away from doing pharmacy stuff. So many to do, my boss won't be very happy if I spend all my time doing stuff that isn't earning money for the store. That's just the way of the world.
But
so
what did we learn today? There might be a way of making revenue.
But full. That's what it's going to circle back to. Full credit to the Apothecare guys that said, okay, we can do this, but we'll, sorry customers, and we would. Don't get me wrong, pharmacists would be the pleased as punch if this will be something that could eventually be charged to provincial healthcare things. But for the moment, it isn't. And frankly, again, sorry, cannabis users. This is usually how things get covered is, enough people pay out of their pocket and then they complain to politicians and then it eventually gets covered. That's just kind of the way things go. It doesn't usually get covered first. So the fact that they have a business where the customer gets charged, the pharmacist gets compensated for their time so they can, have time to do this. Again, there's, as even our two entrepreneurs pointed out, there's lots of holes in this. People, if they don't tell their bud tender that they are using this medicinally, if they don't ask the questions, if they look at the pamphlet but to go, oh, that's too much money. There's still lots of places for people who are using their rec store cannabis medicinally to fall through the cracks, but at least gives them a chance to connect with a healthcare professional. It gives them a chance. There's now at least an off ramp in the rec store, and I think that's great.
Yeah, I do too. I thought it was a really cool story. It was pushed to me, and I thanked them for that story. So I'm Kirk Nyquist. I'm the registered nurse.
I'm Trevor Schufelt. Apparently, today I'm the excited pharmacist.
Yeah, no shit. And we're found at reefermed.ca and all of the socials, most of the socials. LinkedIn we're very, very good on LinkedIn, and Instagram is where I spend most of our time. And our webpage. I really encourage people to go to our webpage. It's an informative page. Lots there. So, yeah.
There is, and Kirk was, before we got on air, just talking about all the things he's done literally today to get everything all spruced up and easier to find us during that they're searching. So yes, it's not like the webpage is static and just staying there.
working on our SEOs, learning from our past guests. So that's what I'm trying to do. Optimizing our webpage. So, and also, guys, please, we've said this before. It's sort of a wine, my wine. Meta doesn't like cannabis. So the only way we get heard is by the people that are already following us. And the only way we can grow on Meta is that if you share our posts. So please share our posts. The other thing is that like us on your podcast platform that you're listening to, share us, and let's let everyone know about Reefer Madness, the podcast.
Give us 5 stars. We're not going to ask for 1, 2, 3, 4 stars. Give us a 5-star review.
Okay, 5 stars.
I think they should.
I
think this was a good one. I think this one deserves 5 stars again.
It's
obviously
a good
horrendously biased, but I think this one was a really good one.
Talk to you later.
All right, have a good day, everybody.
Check out the complete library of Reefer Madness episodes at reefermed.ca. And make sure to follow us on all the socials for bonus info on what Trevor and Kirk are up to.
Okay, Rennie, let's cut this open. That was hilarious, Trevor.
Good. I'm glad.
Okay.